Artificial intelligence is infiltrating all kinds of industries, but now accusations it's messing with medical care.
There are allegations healthcare is being denied, not by doctors or nurses, but by an algorithm owned by Minnesota-based United Health Group and used by Medicare Advantage plans across the country. KARE 11's Lauren Lemanchek investigates how it may be leaving vulnerable people at risk.
In the maze of paperwork that comes with health care and insurance and denials, there's one piece of paper most patients will never be allowed to see.
They call an NH Predict.
That could determine their care. It's here in Dave Draxler's father's file.
Target discharge date, August 18th.
A prediction created not by a doctor, but by an algorithm.
It doesn't seem right to me.
It's a huge issue, and it's growing exponentially.
Kelly Jo Greiner with the Minnesota Board on Aging helps patients in crisis fight decisions made by AI.
We hear from people that are being discharged because their decision has been based on an algorithm through artificial intelligence that has basically said, this person can go home now.
How hard is it to overcome that AI?
Very, very difficult, because the companies rely on this as their decision maker.
Take Dave's dad, Bill Draxler, who lived independently in his Wisconsin house until this summer when he fractured his hip. After 5 days hospitalized at the Marshfield Clinic, Bill needed skilled nursing to rehab.
He couldn't walk. He had to be in a wheelchair to transport him.
It would be a tough recovery, which is why his first meeting with the care team surprised Dave.
They had what they called a predictor model based on a database of these kind of incidences.
Admitted August 1st, it estimated just 17 days of care.
Did you think it was likely he was going to be ready to leave in 18 days?
Oh, there was no way that he'd be ready in 18 days. We all felt that.
But sure enough, on August 18th, Bill's Medicare Advantage plan said his coverage would be cut off in 2 days. At that point, Bill's medical team wrote he still needed maximal assistance just to stand up and was dependent on others to get from his bed to his wheelchair and to use the toilet. His self-care score, a 0.
So he still needed total care to do anything.
That prediction of how long Bill Draxler needed care was created by a company called NaviHealth and is used by many insurance companies. 3 years ago, it was bought by United Health Group, the nation's largest provider of Medicare Advantage plans. Since then, lawyers and advocates we spoke with say Medicare Advantage denials for skilled nursing care have gone through the roof.
The Draxlers appealed to their insurer, but the denial was upheld.
Going home wasn't an option, so you just had to stay there, pay privately.
Thousands of dollars out of pocket.
Our most valuable citizens are up against an impossible system.
Attorney Christine Huberty with the Wisconsin Agency on Aging Resources went to Congress to urge action after seeing so many seniors forced into unsafe situations.
The insurance companies are banking on the fact that these are vulnerable adults in times of crisis and injury, and that they either won't fight the appeals or that in some of our cases, our clients are dying in the process. They do not survive the life of an appeal.
When they fight, she says, they almost always win. Here's why. She says under government-run Original Medicare, almost all of these patients would be covered. Privately run Medicare Advantage plans are supposed to follow the same rules, but don't.
Almost always they are overturned.
But it can take months. With Huberty's help, Dave Draxler took his dad's case all the way to an administrative law hearing, and the insurer settled. But he wonders, what about all the others who don't have an advocate?
That part of it bothers me more than anything.
That's what happened to Joanne Barrows and her daughter Leslie. They say they ran into the same AI denial problem when she broke her leg in 2021.
I assumed she would be able to get care for as long as she needed it.
But Joanne's Humana Medicare Advantage plan cut off coverage for her rehab facility after just 16 days. Leslie says her mom still couldn't walk or use the bathroom without help and still had a catheter in. They had just 2 days' notice.
It was awful.
Staying in the nursing facility without insurance coverage was too expensive. So Joanne wound up at home with Leslie.
And it wasn't a safe situation.
Now she's the lead plaintiff in a class action lawsuit accusing Humana of illegally using AI instead of real doctors to deny coverage, creating a financial windfall for the company. A separate class action suit has been filed by Wisconsin plaintiffs against United Healthcare and NaviHealth. KARE 11 reached out to each company for response. Humana said the company uses augmented intelligence to ensure patients receive high-quality, safe, and efficient care. As for United, the company says the lawsuit has no merit, and NaviHealth is used as a guide. Both companies insist adverse coverage decisions are only made by medical directors. But to the humans behind the algorithm, Leslie has this message.
I would want them to think about if they would want to see their mother go through this.
Well, just this month, the federal government sent a warning to Medicare Advantage plans that AI cannot be the determining factor in cutting off coverage. It's still unclear, though, if that will prompt a change in this practice. Now, we do have information on our website that will help you find resources in both Minnesota and Wisconsin to appeal and to help you win. And guys, this affects so many people because more than half of seniors have a Medicare Advantage plan. So we're talking about either you, your parent, your grandparent, someone you care about will be impacted.
Right.
Yeah, and an
Frustrating.
aging population too. It just gets increasingly frightening. But I'm glad we have those resources. Thanks so much,
Yep.
Lauren.
Great story. Thanks, Lauren.